U.S. Centers for Disease Control and Prevention Country Representative Dr. Mary Boyd has credited Uganda's ability to rapidly detect, trace, and contain Ebola cases.
What's really tricky about this outbreak is that that whole process is not just ending within Uganda's own system and field. We're talking about people who need to be traced as far back to another country, which makes it even more expensive. Some of the things that you're going to see be deployed in this effort are the tests, the testing. So there are these tests that have been developed through CDC support to be effective in identifying the cases. And so these are some of the innovations within the U.S. And also been part of Uganda, our collaboration with Uganda, that you're going to see be brought to bear.
The partnership between U.S. and Uganda has helped build critical systems that are now at the forefront of the country's outbreak response.
U.S. expertise and innovation came in first, but then Uganda built its own. And now Uganda is exporting it, right? Helping Rwanda, helping Malawi, helping others detect, and now going to DRC. That's huge, That's what I call a good return on investment.
Health officials say the country's laboratories, surveillance systems, and trained epidemiologists have enabled authorities to quickly identify cases and monitor contacts before further transmission occurs.
The current outbreak is actually being supported through the field epidemiology trainees and the alumni. So people who they have graduated, they're working in their various areas within the government, some of them outside the government. These alumni are being called in to be part of the surge response for this outbreak. So this is an area that the U.S. government through CDC will continue to invest in, training many more epidemiologists. I think we have a target of about 2,000. We're halfway there, almost 1,000 trainees out there in Uganda.
The collaboration was further strengthened through a bilateral health agreement signed last year, under which Uganda and the United States committed more than $2.3 billion over 5 years toward outbreak preparedness, laboratory systems, and workforce deployment.
It is also easy to focus on the amount that was spent averting the outbreak rather than doing the math for what may have been if it hasn't been addressed. My experience with what the Ugandan government has been putting out to us that we've been working on is a very reasonable budget. At this time, really the heavy focus and probably always one of the more challenging areas is the case surveillance, and then the case investigation.
With most of the Ebola cases linked to cross-border transmission from the Democratic Republic of Congo, Uganda is also supporting regional efforts aimed at stopping the outbreak at its source.
Uganda is now up to more than 90% of the contacts of all of these cases identified and in quarantine. And Uganda has pretty much set up a system to do active surveillance. So we find the cases before they move around very much. And also, as much as possible, to find the cases when people are in quarantine and being monitored so they can get good care. And also so that they don't further spread the cases. So this is actually, Uganda has demonstrated excellence even in this brief period of the outbreak, and is gearing up to go support the DRC because Uganda is clear that unless the fire is put out in DRC, Uganda itself is not safe.
Dr. Boyd says restrictions on movement and enhanced border screening, though often controversial, remain important public health measures in preventing wider international spread.
The reasons behind those restrictions are very valid in this time, but of course the risks are also not insignificant. And really, it's just something that we have to balance as a community.
Health experts say as long as Ebola remains active in the Democratic Republic of Congo, regional cooperation and sustained investment in public health systems will remain critical to preventing further spread. Walter Mwesigye, NTV.